Okay, next up, I'd like to introduce our next keynote speaker. He is Hussaini Manji, a neuroscientist and co-chair of the UK government's Mental Health Goals program. He's got professorships at Oxford and Yale, a former global head of neuroscience at Johnson & Johnson. He has led groundbreaking research and development in neuropsychiatric and neurodegenerative disorders. He will speak on mental health for the brain economy. Please welcome Dr. Hussaini Manji.
Thank you so much. Great to see you. Thank you very much, David, for the very kind introduction. Thank you to Vineet, Harris, and all the organizers. This is a tremendous and timely event, and it's a privilege to be part of it. Morning sessions have been outstanding, and I'll actually reinforce some of the messages. As you can see from my title, and this audience doesn't need convincing, cognitive and mental capital is society's greatest resource. And I'm hesitant to say that in Texas, where, oil country, but really cognitive and mental capital is our most important resource. I'll be focusing on the mental health part of it, but as I've been discussing with George Radenberg and others, these things are intimately connected, and I'll give you some examples. So just to put the scope of the problem into some context, what you're seeing here on the left is the World Health Organization's global burden of disease studies. And sometimes people are surprised to see this data. So this is from North America and Western Europe, but it's basically being replicated worldwide. Mental illnesses are by far and away the leading causes of disability. And you might say, how could that be? Well, probably the biggest factor is that by and large, they strike individuals relatively early in life, late adolescence, early 20s, and they're lifelong. So they are the chronic diseases of the young. And especially for this, summit, when we're talking about brain capital, brain economy, nothing has a bigger impact. This is affecting your whole productivity span than mental illness. On the right, you see some other grim statistics. So in the US, there's only 3 forms of cancer that have a higher death rate than the death rate from suicide. A tragic statistic all of us should be concerned about in young girls and women 15 to 19. Suicide is the second leading cause of death. If you look on the bottom left, you see the World Economic Forum projected that mental illnesses alone were going to cost society more than diabetes, cardiovascular cancer, diabetes, and respiratory diseases combined. And on the bottom right, you've been hearing this already. Mental illnesses have a huge impact on physical health. So people with a serious mental illness on average live about 15 years shorter than someone without it, almost all of it from cardiovascular disease, type 2 diabetes, both the incidence and the outcome. Recently, many medical insurance CEOs have been lamenting the fact to me that about 20% of their patients account for about 80% of the cost, and it's almost all people with comorbid physical and mental health conditions. And, in the UK, one of the things we're trying to do is show that if you treat the mental health condition well, the outcome in physical health is better, and down the road, you actually have cost savings to the overall healthcare system. So this is, indicating that. You've probably seen slides like this, or you'll continue to see. Basically, brain capital is critical to productivity. So what this slide shows is an attempt to relate, sort of cognitive skills, in this case, quantitated by numeracy, to productivity, and they looked across various countries. And if you look at the sort of bottom line, basically what they suggested was that if you're in a profession that's not knowledge intensive, and in this case they suggest that was textiles, basically so it doesn't seem to matter what your cognitive skills are like. You see about the same level of productivity. By contrast, and this is certainly true in our world today, where we are in a knowledge-based economy, it really matters. So you can see that line, sort of going up, where the more cognitive skills you have, the more productive you are. So it behooves us to do something about this, certainly to help people, suffering people and their families, but also for economic productivity. This we've heard a little bit about, is that cognitive and mental capital is tremendously dynamic across the lifespan. Both good news and bad news, the fact that it's dynamic and we can, help it, etc. But the bad news is that there are things that deleteriously affect it. One of the first panels we heard about, the early brain development, you can see a couple of things I've shown there. And, what was mentioned about the first, 1,000 days of life. So, that's a critical window. And in our society, unfortunately, childhood poverty really impacts it. And in the context of mental illness, perinatal depression, especially postpartum depression, unfortunately relatively common, and unfortunately really prevents mom from bonding with baby. And there's no doubt it affects baby's, growth and trajectory. And, I don't want to, sound like I'm trying to cure world hunger, but, we're in a knowledge-based economy. You're going to need your brain and your mind to perform and function. And you're going to have a hard time to break the cycle of poverty if you're starting at this disadvantage in early life years where your brain isn't developing as well. On the right-hand side of the slide, again, everyone knows this, and, Joanne and others alluded to too well, with dementia, Alzheimer's disease, other forms of cognitive decline in late life, we obviously have a huge problem. And as she alluded to, it's not just the individual, but their care partner as well that gets affected. But what I'll obviously draw your attention to is the middle, which is basically our whole productive lifespans. And I don't want to insult anyone, but, our whole productive lifespan. And that's where mental illness rears its ugly head. So it's not surprising that in addition to pain and suffering, it has a huge economic impact. So, everything you can see on this slide, basically you know about. So, I can't tell you the number of patients I've seen who unfortunately didn't get the right treatment earlier in life, and they dropped out of school, they dropped out of work. So a lot of people with mental illness had completely drop out of the workforce. A large percentage of people, are basically absent, the absenteeism. But then something that many of you probably know but isn't recognized as well is presenteeism, where you're physically there, but your neurons aren't firing. So you're really not as productive as you should be. So these things really cost trillions to society, and we can and should do something about it. We had a great panel on workplace mental health, and this, recapitulates some of the advantages. And I was delighted to see that Mitch Elkin from the American Heart Association also spoke, because a few years ago I was invited to speak at the American Heart Association CEO Roundtable, which is basically bringing some of the leading employers together, and he asked me to speak on mental health. And really, the main message was not only is it the right thing to do, you want to be decent employers, you want to help your employees, etc., but it's actually a huge productivity lever. You pay attention to this and you'll get rewarded many times over, as you can see on this slide. One of the reasons I also want to emphasize this is I think we're in a time where there's this almost a sentiment that these young people, they're wallflowers and we're woke, and we don't want to focus on this namby-pamby mental illness type of thing. But you heard earlier, special forces, these are the guys who jump out of planes. These are guys who swim underwater for 10 minutes. They pay a lot of attention to mental health and resilience because they recognize it's a force multiplier. Now, if they do it, surely we shouldn't treat it as a soft, nice to have thing. It's imperative to have, as I said, not only care for your employees, but actually improve productivity. I think that the secret sauce for success for most companies is actually the talent you can attract and retain. And there have been a couple of these surveys in the UK, which has asked young people, what factors do you look for when you're considering going to work for a company? And mental illness was, the company paying attention to mental health was one of the leading considerations. So again, this is, not only, sort of being decent, this is actually a strategic advantage. If you're a company that pays attention to us, you've got a greater likelihood of attracting and retaining the best talent, which, as I said, I think is a secret sauce for, success. Now, I think we're, if you heard from several of the presentations, I think we're at amazing times in terms of biomedical research and scientific breakthroughs. And a lot of them are translating into huge impact on human health. And on the left, you see, some of the findings with oncology, where, unfortunately it takes a long time. So President Nixon launched the war on cancer something like 70 years ago. And in my opinion, it's the last, of course, we've had things like smoking and, prostate cancer and breast cancer screening. But I think it's the last decade where we've really seen advances. And, the graph on the left doesn't even really fully capture the benefits we're going to see from things like immuno-oncology and CAR T. Now, I think one of the challenges we have is that, we need to try and make them accessible to everyone. And right now, the cost of these medications, et cetera, could be a challenge, but hopefully we can, sort of rally as a society. And on the right-hand side, cardiovascular disease, you can see this is again a UK study that looked at, sort of decline in cardiovascular mortality from in both men and women. And you can see the dramatic decline. And I'm one of those people who think GLP-1s are going to have a huge impact on this. So this is, dated. This doesn't even, factor into the equation the impact of GLP-1s. And I'm not suggesting they're a panacea, but I think the data we're seeing is really good. So biomedical research is having tremendous benefit in human health. Obviously, we need to do the same sort of thing in neuropsychiatry. But it's well and good to say we need to do the same. But if the science isn't there, you can want to all you can. But I'm here to tell you that the science is certainly there. We're actually at an inflection point in our understanding of the functioning of the brain and the mind. And we're no longer talking about too little serotonin or too much dopamine. These are some of the pathways and the targets we're looking at. And this isn't futuristic science fiction. All of these are actively being investigated today. On the top middle panel, I had the pleasure and privilege while I was at J&J to launch a novel antidepressant that treats severe suicidal depression in hours rather than weeks, working on those synaptic plasticity pathways. And as I said, things related to glial cell function, inflammation I'll come back to, targeting brain circuits, whether it's with medications, software, devices, etc. What you heard already about, crossing the blood-brain barrier, and then might be a little bit further away, but genetic and epigenetic targets that I'll come back to. One of the things you heard already, and this is turning out to be quite true of mental illness, I mentioned that people with serious mental illness live on average something like 15 years shorter than someone without it. And there's a lot of data to suggest this is due to aberrantly activated inflammatory pathways, certainly changes in the autonomic nervous system as well, which you just heard about. But this isn't just about lifestyle. Yes, people with serious mental illness might not exercise much, might have poor diets, might smoke, but this is a biological phenomenon. So what people have been starting to do is, okay, these things affect the body. In some patients, could this also be affecting the brain? And the data is looking really solid that some of these inflammatory cascades basically drive the mental illness as well. So just like we're seeing in dementia, where, in immune targets like TREM2, so for those who don't know, TREM2 is looking like it's a second highest genetic risk factor next only to ApoE4. These things are looking very relevant. And one of the other good things about this is that it also starts to get us into slightly more of a precision medicine approach, because some of these things you can measure in the periphery. So you wouldn't take every person who walks through the door and put them on an immune modulator. You would identify, do you have this immune subtype of illness? And if you do, then you would go on IL-6, something called P2X7, which regulates microglial function, et cetera, et cetera. So we really are starting to get away from the one-size-fits-all and target our treatments to the specific patient. And obviously, oncology is the poster child. I think they have an advantage where they can do biopsies and just see what's there, et cetera. We can't do brain biopsies, but I think we're starting to see much more in the way of precision treatment. We've heard several times, and I think this is very true, almost all our illnesses, cardiovascular, asthma, type 2 diabetes, dementia, mental illness, they're a combination of genes and environment. So, and that's the good news. Bad news is that, environmental unfortunately has a, negative impact, but the good news is that you can hopefully do something about it. So the question has been, how does, for example, early life stress permanently put you at risk for all these things? So how does stress get under the skin? And we think it's something called epigenetics, and I'll walk you through that. So we're born with certain genes, and basically, unless you have a mutation in one of those genes, that's kind of what you're going to die with. But genes are getting turned on and off all the time. So for example, you heard the analogy of exercise. If you lift weights or you run, you'll turn on or turn off certain genes that allow you to lift more weights, run further, etc. Theoretically, you're listening to me right now is turning on some synaptic plasticity and epigenetic changes that will, a year from now, allow you to remember this. You may not remember every detail, but you'll learn that you're at the Brain Summit, Brain Economy. And how's that happening? How are you a year from now going to remember this? It's through this epigenetic changes. And I think a couple of examples to highlight, that this is actually a very understandable phenomenon. On the top left, I was thinking that the hardware might represent your genes. The software represents the epigenetics, the programs you write. And then the output is a combination of genes and the epigenetic changes. I think one of the most striking examples from biology is what you see on the bottom left. The caterpillar goes into the cocoon. It's got all the same genes, but it comes out as a butterfly because certain genes have been turned on or off. So this is really powerful. And the reason I'm bringing it up is if you look on the right-hand side, we're now understanding a lot about the mechanisms. So it looks like you put on certain chemical groups, methylation, acetylation, etc. And now in any of us, we could sort of measure, for example, stress hormone genes. Have these been genetically modified so that in the face of stress, it's going to go, sky high, etc. So you can not only measure some of the epigenetic changes and risk factors in people, but this is a little bit science fiction-y, but there are studies going on. The things called HDAC inhibitors, histone deacetylase inhibitors, and there's rodent studies in dementia looking at HDAC inhibitors. Will it happen for humans? I don't know yet, but this is another exciting area. You heard already, I think one of the real advantages is also going to be technological, the ability to send molecules across the blood-brain barriers. The blood-brain barrier is basically devised to keep poisons out of your brain, which is a good thing, but it makes it difficult to deliver drugs. So until relatively recently, we were faced with having to have this small molecule with a molecular weight less than 500 kilodaltons and very specific lipophilicity characteristics, which is why most medications in neuroscience are pills. Now we've got the ability to use technologies to deliver things across the blood-brain barrier. So the Alzheimer's example is a good one. So obviously we have these monoclonal antibodies, donanemab and lecanemab, that have been approved. Data seems to suggest that only about 0.1 to 0.5% of the level in your plasma actually crosses the blood-brain barrier. In this case, I think it's quote unquote fortunate that a small amount of antibody that crosses the blood-brain barrier actually sort of interacts with amyloid plaques and has what we call a long residence time in the brain. So it stays in the brain longer, even though a small amount gets there, and it catalytically breaks down amyloid, etc. But for most things, you actually want to get more into the brain. Roche has you heard about this, Trojan horse or brain shuttle technology. Roche has some interesting phase 2 data using a brain shuttle Alzheimer's antibody that's looking good. So not only is it looking good from an efficacy standpoint, for these monoclonal antibodies, they seem to be actually, donanemab, lecanemab, generally very safe. They have one serious side effect, which is rare but serious. It's something called ARIA, amyloid-related imaging abnormalities. And the thinking is that you have amyloid present not only in the brain parenchyma, but also in the blood vessels. And when you take the amyloid out, you can temporarily make the blood vessels leaky. With the shuttle technology, it looks like they're sort of markedly reducing the likelihood of ARIA, which, as I said, although it's a rare side effect, it's a serious one. So this is going to be very useful. The other technology that I'm excited about is something called focused ultrasound. So focused ultrasound right now is approved for Parkinson's disease and essential tremor, where it's kind of used as a lesion. But if you dial back the intensity a lot, you can temporarily open the blood-brain barrier in a very specific part of the brain. And you could potentially deliver a nucleotide-based treatment or a protein-based treatment and get it there. So for example, in Alzheimer's disease, we think the entorhinal cortex of the hippocampus is one of the first areas things start. Wouldn't it be fantastic you could deliver a payload specifically there? And there's a lot of work going on there. This slide, and I'll walk you through it if you're not familiar with, but Joanne referred to it as well in terms of the excitement and progress in Alzheimer's disease. And I was talking to George Radenberg. So on the right-hand side of the slide, if you're not familiar with it, I'll walk you through it. So these concentric circles basically represent treatments in development, with the closer to the bullseye treatments that are in late stage, for example, phase 3, which is usually the last stage before you get FDA approval. And as you go outside phase 2, phase 1, etc., as Joanne mentioned, a number of different kinds of modalities, amyloid, tau, neuroimmune, synaptic plasticity, etc. And what George was mentioning, this is, sort of captures what's going on kind of in the US. There's a lot of studies going on in China. This doesn't include device studies, etc. So this is a snapshot, which is not even completely accurate. The reason I'm showing this is, I think many people, and I'm a firm believer, that lecanemab and donanemab would not have gotten approved without biomarkers. So I think we've all known forever that Alzheimer's disease is not Alzheimer's dementia. The dementia is the end stage of a disease process that's been cooking for 15 or more years. And, the writing was on the wall. If you try and intervene at that stage, you can only have so much success. So you need to intervene early. But how the hell are you going to do that? We don't have cholesterol or blood pressure. So a lot of work, a major public-private partnership called ADNI, Alzheimer's Disease Neuroimaging Initiative, identified these biomarkers. The regulators were at the table. So the FDA approved these biomarkers. So if Lilly or Eisai Biogen want to do these studies, they could identify people using these biomarkers. And they started with brain imaging or cerebrospinal fluid. And, that was very useful. But what's been remarkable is now, as you heard from Joanne, a plasma-based biomarker, phospho-217 tau, is turning out to be amazingly good. So when I was at J&J, we actually did a lot of work on P217 tau, and I was one of those people who thought, oh, well, it's going to be a good screen. Mr. Smith, you look fine, come back next year. Or Mr. Smith, your plasma 217 tau looks a little bit off. Let's send you for a PET scan, amyloid scan, etc. But it's actually turning out to be amazingly good. So it may well become good enough. And obviously, as we're thinking about, intervening early and perhaps even preventing, you simply can't do that if you have to send people for PET scans. If you could do something with a blood test like we do with cholesterol, that would be game changing. Then obviously we have the problem of, not enough places to administer it, sort of cost of treatment, etc. But at least we'll be able to identify and hopefully get people to treatment. This is happening in psychiatry as well. So, when you look at something like major depressive disorder, it's certainly not one entity. And if you look at the diagnostic classification, then, it's obvious. The diagnostic classification says depressed mood, anhedonia, sleep too much, sleep too little, eat too much, eat too little, low energy, revved up, etc. It can't be the same disease, right? So now we're starting to identify subtypes of depression, and this study from Stanford suggesting these 6 so-called biotypes. But one of the things I think is very important is that you want to do these studies, but then just like we did with plasma 217 tau, you want to develop inexpensive, accessible, routine biomarkers, because to help people at a population level, you can't just send them to Stanford or Harvard or wherever for this brain imaging. You got to have these things. In the UK, we're doing a study of 30,000 patients, and while we're getting brain imaging and magnetoencephalography and all the bells and whistles, we have basically insisted that these sophisticated measures have to turn into a proxy for something like plasma, saliva, digital. We're even looking at home-based, computer-based tests, etc. Even if it's not perfect, it'll really help us to reach more people. And this, again, we hear much more about AI. So, people sometimes say the brain is the most complex organ in the body. I think that's a ridiculous statement. The brain's the most complex entity in the universe. You're talking about billions and billions of neurons forming all these synaptic connections, etc. So the good news is that we're generating a hell of a lot of data. The bad news is that we're generating a hell of a lot of data. But fortunately, AI is really helping us to understand this data. So from brain imaging, from digital, from clinical symptoms, from plasma. And as I said, neuroimmune interactions are going to turn out to be very important. And the immune system's probably second only to the CNS in terms of complexity. So we can now start to utilize AI to start to make sense of a lot of these things. And I think it's going to be really helpful. What I'd like to segue briefly on, and we've sort of touched on already, so, hopefully you have no doubt mental illnesses are horrible. We got to do something about them. They affect productivity, pain and suffering in the workplace. What's underappreciated is that they're intimately linked to neurodegenerative disorders. So the first thing is that most patients with neurodegenerative disorders like dementia or Parkinson's start with psychiatric symptoms. The second thing is that in many countries around the world, nursing home admission for dementia is more predicated on behavioral symptoms rather than memory problems. And the last most important thing, and you heard that, what's good for the heart is good for the brain, etc. I'm angry actually. So you look at the Lancet Commission, and depression, a history of depression, has at least as big an impact on the likelihood of developing dementia as cardiovascular risk factors, smoking, etc. But it hasn't been appreciated. So it basically weakens the foundation. And how does it happen? So we think it's this thing called neuroendangerment. So if you look at the top left, that's, you heard about those dendrites. This is, it's an example of a healthy neuron where you see those branches. And then next to it, you see these things with the knobs that look like Shrek's ears. Those are spine densities where one neuron makes a synaptic connection to the next one. If you look at the bottom, this is either in people with serious mental illness, and these are postmortem brain studies, or when you take rodents and severely stress them, you can see you've got fewer of those branches, and then a lot of these dendritic spines have sort of retracted. So it's a bad news, good news picture. The bad news is that the neurons are sick. The good news is that they're not dead. But then when you subject them to a second hit, and the second hit could be the, beta amyloid, ischemia, etc., that's shown in the middle. So what you're seeing in the middle at the top is, sort of an area of the brain called the hippocampus. And, I've just shown you with the red arrow a specific part of it. When you look in the middle at the bottom, you can see the animals that had been previously stressed, then they're given this second hit, their neurons die. So at the top, it's the same, these are control animals which have been given the same second hit, their neurons don't die. The neurons which have been previously stressed, and I'd argue that's a proxy for serious mental illness, those neurons die. And so that moves into, all these illnesses, etc. And I think, sort of that, ignoring mental illness while you're trying to treat dementia is somewhat akin to focusing on myocardial infarctions or strokes while you've ignored a lifetime of hypertension. It does not make sense. So clearly, I think, as I've said, and I'm wrapping up very soon, intervening early is going to be very important in mental illness. And in the UK, with the Wellcome Trust, which is not the same as the Wellcome Leap, which is doing some very good work, we're organizing a major youth mental health initiative. We want to show that intervening early will improve outcomes, reduce pain and suffering, have this huge impact, unlock decades of productivity. But as I've said, hopefully even have an impact on things like dementia. And that's why I think this summit is so good, because when I've been speaking to the organizers, they've been talking about the fact that they don't want silos. And this is one of the silos I think we need to break down. We really need to try and study mental illness and neurodegen together because of their interlinks. There's mentioned the common symptoms, etc. And there's a lot of shared biology. So one will benefit the other. So the more we can get away from these silos, the better. And obviously that brings me to Texas. So I think it's fantastic what Texas is doing, you've basically got all the pieces in place to really make a difference. I was at the NIH for a number of years before I moved to J&J, and I was an academic, and, we do very good science, et cetera, et cetera. When you go to a company like J&J, you realize that, if the good science doesn't reach people, if it sits on the shelf, you actually haven't helped that many people. So I think Texas, with its translational focus, is in a great position to take the science and help humanity. And one of the things, might be sort of the translational research you're doing. I was hesitant to say incubators because when I was at J&J, we developed a lot of incubators, and after I left, they closed the one in Houston. So I'm sorry, it wasn't my fault. But I think there's a lot of things you can do. And I think the DPRIT model is a fantastic one. It can really make sure, and that you can really help humanity and really impact the community. So, like you've seen in the Bay Area or Cambridge, Mass, when you sort of make this investment, you have a huge return on investment. And, I would argue that if you can especially also include mental health as you're focusing on neurodegeneration, you're actually going to be far, far ahead. So hopefully I've been able to convince you, not that you need it convincing, that cognitive and mental health is critically important. It behooves us all to do something meaningful about it. I think Texas is in a unique position to not only enhance it, but maintain it during our lifespan, and society will benefit tremendously from it. Thank you very much for your attention. Okay?